Asthma is a global health problem which afflicts over 330 million people worldwide. The disease presents a huge economic cost, directly from hospitalization, treatment, and healthcare resource utilization, and indirectly from time lost from work, absenteeism, and premature death. The cost of uncontrolled asthma is estimated to be 1.5 times that of controlled disease, highlighting the need for better disease management. The Recognize Asthma and Link to Symptoms and Experience, or REalize survey. The largest appraisal of asthma patients in Europe showed that asthma control remains low. Optimal levels of asthma control achieved in clinical studies were often not replicated in real life. These differences between real life and clinical studies are attributed to a complex interaction of guidelines and disease, patient, and doctor-related factors. To probe further on patient and physician perspectives on asthma in this part of the world, REalize Asia was conducted across 8 countries in this region. With the aim of generating specific and actionable recommendations to address identified needs, the study was planned and carried out in 2 parts. REalize Asia Part 1 surveyed 2,467 patients with asthma to understand their perceptions and attitudes towards their disease and its management. REalize Asia Part 2, on the other hand, surveyed 375 physicians managing patients with asthma and was conducted to understand their views on asthma control, inhaler selection and techniques, and how asthma consultation process can be improved. 5 attitudinal control clusters were identified from the rich data obtained in REalize Asia Part 1. Beginning with the responses obtained from survey questions describing asthma patients' attitudes and behaviors, a list of 27 attitudinal variables were identified. Using factor analysis, linkages were established between these attitudinal attributes and the extent to which they are correlated within patients. This allowed for the separation of truly related from apparently related attitudes and resulted in the creation of 9 summary factors. Using cluster analysis, the patients were segmented into groups based on their ratings against the 9 summary factors. Since the GINA-defined control status improved the segmentation model, it was used as a covariate. 5 distinct and actionable groups then emerged, each containing asthma patients who are similar in their attitudes and behaviors. When presented to physicians in REalize Asia Part 2, they perceive the patient clusters to be relevant and applicable to the patients they encounter in their practice. They also recognize the differing needs and priorities for these 5 patient types and believe that a tailored management approach is needed. Indeed, the recognition of the 5 clusters offers a unique opportunity for healthcare professionals to customize management approaches for their patients. Mundi Pharma, in collaboration with experts in this field, has developed and validated a simple patient profiling tool to help clinicians accurately identify the clusters to which their patients belong. Furthermore, an international panel of 11 clinicians and allied health professionals in both primary and specialty care were convened by Respiratory Effectiveness Group to generate asthma management recommendations tailored to the characteristics of each of the clusters. The knowledge of the cluster to which a patient belongs will assist healthcare professionals tailor their treatment approach and use the appropriate asthma management recommendations to improve its outcome. Let us now take a look at the characteristics of patients in attitudinal control cluster number 1. Patients in these clusters are not heavily impacted in daily life by their asthma, are the least stressed. Patients are most confident about their doctors, have the least problems with their inhalers. They are more at ease with their asthma than other segments, both physically and mentally. However, they still experience symptoms and exacerbations, as reflected in the proportion of patients achieving well-controlled asthma. Despite them appearing as well-adjusted, there is indeed a room for improvement in terms of asthma control. Based on these characteristics, What will be an appropriate name, descriptor, or label for this attitudinal control cluster? Let us now take a look at the characteristics of patients in attitudinal control cluster number 2. Patients in these clusters are more impacted in daily life by their asthma as compared with those in cluster 1. They are socially conscious about asthma and are more inclined to deprioritize their health. They are embarrassed about using inhalers. They are likely to report more problems with the inhaler. They are most independent in managing asthma and most likely to reject the asthma label. Based on these characteristics, what will be an appropriate name or descriptor for this attitudinal control cluster? Let us now take a look at the characteristics of patients in attitudinal control cluster number 3. Patients in these clusters have the highest level of stress in daily life. They have the highest tendency to have problems with asthma inhalers and are most socially conscious about asthma. They deprioritize their health the most and have the least confidence in their doctors. However, 88% of the patients in this cluster still think specialists are trustworthy information sources. It suggests that their low confidence in their physicians isn't necessarily linked with trust, but a reflection of feeling lost. Based on these characteristics, what will be an appropriate name, label, or descriptor for this attitudinal control cluster? Let us now take a look at the characteristics of patients in attitudinal control cluster number 4. Patients in these clusters are neither highly impacted in daily living nor socially conscious about their asthma. They are highly accepting of their asthma label and are not overly anxious about their asthma. They have suboptimal control levels and are not very confident in managing their asthma themselves. They are highly dependent. They accept that their asthma is severe and that they cannot control it. To some extent, they transfer the burden and responsibility for asthma care to their physicians. Based on these characteristics, what will be an appropriate name, label, or descriptor for this attitudinal control cluster? Let us now take a look at the characteristics of patients in attitudinal control cluster number 5. Patients in these clusters suffer the most from impact of asthma in daily life. While confident in their doctor and willing to accept the asthma label, they still experience high stress in life. They have the highest percentage of uncontrolled asthma according to GINA-defined criteria. Unlike other less well-controlled segments, patients in this cluster prioritize their health and have the highest information-seeking behavior. As compared with the other clusters, they are most anxious about their condition. Based on these characteristics, what will be an appropriate name, label, or descriptor for this attitudinal control cluster?